Welcome back. This year has been an emotional roller coaster, and having good mental health is really vital. In celebration of Pride Month, we want to stress the need for self-care, especially in the LGBTQ community.
Menninger 360 Program Director and licensed clinical social worker Estey is here to share the importance of mental health in the LGBTQ community. Welcome to the show. And first of all, let's just jump right in. I know when it comes to statistics, clearly there are fewer LGBTQ folks in the population than the heterosexual community. But the reason why this conversation is important, Matt, is because if you are part of this community, you are much more likely to experience stress and thoughts of suicide even.
Yeah, that's absolutely correct. So the LGBTQ community is about 3.5% of the population of the United States. For reference sake, that's about the population, a little bit greater than the population of Kentucky. And when we compare this population with the heterosexual community, what we find is about 40% of folks who identify as LGBTQ will say that they've experienced mental illness in the last year, compared to 20% in the general population. When we dive down in that a little bit more and we specifically start to look at LGBTQ youth, what we find is that they are 4 times as likely to report having suicidal thoughts, attempt suicide, or exhibit non-suicidal self-injury.
You know, when you break it down and look at those percentages and you see the dramatic increase when it comes to our LGBTQ youth, that has to now open up another conversation, because what are the main stressors? There's obviously a difference here when it comes to the youth. And so what are they experiencing, or what have you been able to find out, especially during this time of pandemic?
Well, it's a fascinating question. So they've had surveys where they go into school settings and they ask kids, what stresses you out? And what's absolutely fascinating is that heterosexual kids will say, in this order, classes, exams, and grades. LGBTQ youth respond very differently. What do you all imagine their response is?
Fitting in?
Fitting in, yeah, I would
being
guess.
Isolated?
Family, social pressure. I mean, yeah, that would be
those
our guess.
Those are great responses. The number one response by that population is that their families won't love them. The second response is getting bullied or picked on at school. What is fascinating about that response is that their stressors, their school-based stressors, have nothing to do with academics at all.
Wow. Well, and it's interesting, like we've talked about this before. Growing up, I grew up in Salt Lake City, where everyone was like one thing. And if you weren't part of that one thing, that mainstream, Matt, then you were isolated. And I woke every morning before 7th grade. I felt sick to my stomach. I was terrified of going to school. And it's interesting, Matt, that in 2020, I mean, there's still these conversations happening about equality. Last week, when the Supreme Court ruled that LGBTQ folks cannot be fired from their jobs, so many people responded by saying, oh my gosh, we didn't realize this was legal in half of the United States. So are we making progress in this fight for equality? Because when you look at the suicide numbers and the stress levels, it certainly seems grim.
Well, I don't think there's any doubt that there's still significant disparities. You just pointed out, like, up until recently, like last week, a significant legal disparity for people who identify as LGBTQ. But I think the fact that we are even like raising these questions and talking about that does signify that there has been real progress, and there's just a lot more that needs to be had. And I think we can see that in a lot of different kind of areas of society right now. And I think it's become much more prevalent and talked about.
Exactly. The conversation is there, and clearly it needs to be. So when we go and speak about the youth here in the LGBTQ community, are you seeing an increase in calls right now, or how do we reach that population to say, you shouldn't be stressed, or let's help you deal with what you're dealing with? What are the avenues for them?
I think there are all sorts of community-based organizations. Certainly the Menninger Clinic is also involved in impacting youth, both from perspective of treatment and prevention here in our community. But I think there are lots of organizations that are pulling in the same direction to address things like family acceptance, stigma, bullying, things like that.
Let's talk specifically for a moment, Matt, about the transgender community, because we've heard talk from Washington about access to care, to health care when it comes to the trans community. Can you explain what's happening?
So I want to say almost immediately before the Supreme Court ruled 6-3, saying that it was not constitutional for corporations to fire someone just because of their sexual orientation, the White House put out an executive order saying they would provide some sort of legal coverage for healthcare providers to not provide care to trans people or really anyone that they felt somehow abrogated their kind of religious beliefs, which is shocking as far as I'm concerned.
It really is. And I think the conversation, it's important that if somebody is dealing with this within their family, they are not alone, number one, but communication has to be the key.
Absolutely. For those of you who've ever watched the story of like Harvey Milk, for example, one of the tools that they used to address the stigma against homosexuality back in the late 70s was everybody who is homosexual, whether they're in the closet or not, he had them contact their family members. He had them contact their loved ones. And so people could put a person to a sexual orientation. So there wasn't just this big mob of gay people or something like that, but people that were known and cared for and loved.
Our friends and our neighbors and our colleagues, yes. I mean, this community is part of our society, whether some people like it or not. Matt, I'm sorry we have to end the conversation there. We are out of time, but thank you so much for your thoughts and for your advice. And to our viewers, if you would like to connect with Matt, you can visit our website, HoustonLife.tv.
Thank you, guys.